Would you know the difference between an OCD, compulsion, or ritualistic behavior and a childhood tic? Most of the time, parents miss these completely. I see that often in my practice. I'll tell you what the difference is and how to spot it. That's what's up next. OCD rituals are often missed with the kids I work with because they look very similar to tics. And in fact, a lot of times parents will come in and when I'm gathering history, they'll mention, yeah, oh, and by the way, he does this weird blinking thing, or he does this weird thing with his hands, and he just has some tics. They go away, they come and they go. They're kind of episodic. Or they'll say, yeah, she's got some quirky behavior, and that's just who she is, but it goes away. Or sometimes they'll even have an excuse for it. Sometimes when she gets really hot, she makes this gesture, and it's just one of those things we're trying to work on. We notice that she does it a little bit more when she's anxious. And normally when I meet with those kids, more often than not, I'll start to explore with the child why they're doing that behavior or their awareness of that behavior. And more often than not, it will be more of an OCD compulsion and not a tic. So what the heck is the difference? Let's talk about it. Okay, well, they can look exactly the same. And in fact, the same part of the brain that triggers tics also triggers OCD. So there's a huge overlap and correlation between Tourette's and tics and OCD. However, they are very different and they're treated differently. And so it's important for you as a parent to know what the difference is. So for starters, number one, kids have a purpose around an OCD compulsion. So let's, for this video, use an example throughout the entire video. Let's say there's a child that comes into my practice. Let's use a real example. So a child came into my practice and they were blinking. And so their eyes were doing something like this. They were blinking once, and then they were blinking 3 times, then they were blinking once again, and then they were blinking 3 times. And periodically the parent would notice, why is my child blinking like that? And they chalked it up to some eye tics. And the pediatrician said, yeah, those are eye tics. Don't worry about it, she'll probably grow out of it. Well, when I started to work with her, they were not eye tics because she started to talk to me about how she feels like she has to do certain things to make herself feel better. And some of those include blinking her eye. So she had a thing with numbers, which a lot of kids with OCD have. And she felt that if she did things in 3s, nothing bad would happen to her family, which is a common, OCD type of ritualistic belief system. We're not going to go into all that today. I'm going to make a lot more videos on OCD because it is something that I'm really passionate about, and I really want to send out some good videos to help parents and families. But she was blinking once, her normal blinking, and then she was blinking 3 times to prevent her family from getting hurt. So there was purpose and anxiety around the behavior. And that's the first way that you can tell the difference between a tic and an OCD ritual, is that there is intention. And if I have a tic, I might be able to control it for a brief period of time, because even with people with Tourette's or other simplistic tics, they can hold it in for a little while, but eventually they need to do it. With an OCD compulsion, there is purpose behind it. There's intention and anxiety, and they're doing it motorically, they are doing it on purpose. They can control it. It's not like a knee-jerk type of reaction or something that they can't control in their muscles. It's a calculated, intentional behavior. So as a parent, there are several things that you can do. For starters, you can talk to your child. Now, a lot of kids feel really uncomfortable and embarrassed by their OCD rituals, and that's why OCD is so hard to detect in children. But you can try initially to just talk to your child. Ask your child, what would happen if you didn't do that behavior? So let's talk about the eye blinking to be consistent through the video, and say, let's just pretend we're talking to that little girl, and say, what would happen if you didn't blink your eyes? Now, sometimes if it is OCD and they are not trying to, hide it, they'll say things like, well, something bad might happen, or it just doesn't feel right, or, well, I need to do it. So those are very much OCD type answers. For the kids that I work with who have tics, they will say, I don't know. I don't even know that I'm doing it. Or it just happens. I don't know. You'll get like a more general blasé kind of response about it, like, I have no idea. Because they're not always aware that they're even doing it. So definitely ask your children and see what they say. Also, I would pay attention to other behaviors, because normally you're going to see other OCD ritualistic behavior besides that one tic-like behavior. So pay attention. Are they doing anything else that seemed a little bit quirky? Be careful about chalking things up to quirky behavior too soon. Pay attention, look for patterns. You can ask your child, is there anything else? This is what I ask kids in my practice. Is there anything else that you feel like you just need to do sometimes, but it doesn't make sense? A lot of times when I ask that question, I get a big answer from kids with OCD. And they'll say, well, yeah, sometimes I feel like I have to tap 3 times on my heart to make sure that my mom still loves me. Or sometimes I feel like I have to sniffle until it feels right. Now it's tricky because sniffs and throat clearing are very common tics, but they're also common OCD rituals. And so if you notice those things, you want to ask your child what will happen if you didn't do that, and see what they say. If you're concerned with your child and you're seeing tics that you're not sure are tics, or if they are OCD compulsions, definitely go see a specialist. Not every pediatrician is going to be schooled in that area. And so you want to go see a child therapist that specializes in OCD. You want to go see a neurologist and get some professional input into what you're seeing. I definitely wouldn't take a wait and see approach, because with OCD, the sooner you get your child treatment, the much better their prognosis. And kids do really well with cognitive behavioral therapy. So, don't be naive. Go and find out what it is so that you can get your child help as soon as you can. I hope that helps detect whether you're looking at tics or OCD. For more of these videos, don't forget to hit that button over there and subscribe, because I'm going to be doing lots of series on OCD. And you can check out my parenting e-course, How to Parent Kids with OCD, which covers all of this and a ton more. So until next time, I hope you find the sparkle in every day. I'll talk to you later.